It just shows where the government's priorities are. They don't care about us.
Montrealers who want gender-affirming surgeries are facing longer wait times because of what one clinic says is a reduction in funding from Quebec's health ministry and Santé Québec from April 1st, 2025 to March 31st of this year. GrS Montreal, a private clinic, receives public funding to perform a variety of gender-affirming surgeries to Quebec residents in the city. They say that the funding cuts have directly impacted wait times that can range from 24 months to 36 months, depending on the surgery.
Well, it represents a cut of about 30% of the volume that was done for patients in Quebec. You take the money, you remove it, and suddenly their waiting time is 36, 48 months.
It is absolutely government problem. The thing is, gender healthcare can be treated like any other form of healthcare in Quebec. It can be offered through RAMQ. It could be offered through our public hospital system. But instead, the Quebec government has put a prohibitive clause into the regulation respecting the Health Insurance Act, blocking any access to gender-affirming healthcare through the public system. So this means that GrS Montreal has a monopoly.
This is a situation where some people, it's a matter of life or death concerning their own personality and their own dignity. So of course we find very shameful that the state is starting to cut or to reduce such services that are essential to some of the people.
Surgeries are performed here inside this private hospital center known as the CMC. Celeste Trianon, a trans advocate, says that GrS Montreal is the only option in the city for people to get subsidized gender-affirming surgeries and that the wait times can have a significant impact.
It can be psychological. It can be a question of people not being able to feel good in their own bodies. It can also be physical.
It could result in some cases even suicide. So there would be a mortality with very prolonged waiting time for this group.
GrS Montreal adds that they have been making efforts with Quebec's health ministry and Santé Québec to document the impact their wait times are having and are actively trying to secure funding to reduce these delays for surgeries.
We hope that the government will hear our arguments. We hope that the community will help us making this argument, across the board known to the public. And I believe we'll find a solution soon.
There are ways to resolve this at lower cost. Yet at the same time, the Quebec government has shown a complete disinterest in the matter. So I really do hope that this is something which the government will just realize is healthcare.
In Montreal, Gareth Madoc-Jones, City News.